welcome to my channel Maalin Tutor. Today we are going to know about bird flu, which is avian flu. Avian influenza form H5N1 virus is a viral infection that attacks the lungs, nose and throat. This type of influenza mainly affects birds and also spreads to humans. People are also affected by direct contact with the infected bird. Moreover, the disease can be transmitted from one person to another. The flu and the common cold have similar symptoms. It can be difficult to distinguish between the two illnesses. The symptoms are more severe and last longer than the common cold. There may be higher risk for infections. It includes children under the age of 5 and adults ages 65 and older. There are 3 different types of flu viruses that affects humans: type A, type B and type C. There is a fourth, type D, that does not affect humans. Animals and humans can contract type A because the flu virus can be transmitted from animals to humans. Type B, flu can also cause seasonal outbreaks during the winter months. However, this type is typically less severe than type A and cause milder symptoms. Occasionally, type B can cause severe complications. Type B can only be transmitted from humans to humans. Type C, flu affects humans and some animals too. It causes mild symptoms and few complications. Symptoms of bird flu are sore throat, sneezing, runny nose, fever, body pain, headache, dry cough, nasal congestion. How to prevent this bird flu? Don't touch the infected birds. Use mask and gloves when dealing with chicken. Wash your hands frequently, especially before and after handling food. Avoid public places if you are sick. If you have symptoms of flu, go for a medical checkup, getting an annual flu vaccination. Avoid going animal market or poultry farms. Use different utensils for cooked and raw meat. Avoid consumption of half-cooked chicken, meat and eggs. Don't keep raw meat near cooked meat. Share and subscribe my channel.